LOWcast. Be informed about the issues that matter.
A special co-production with the European Academy of Paediatrics.
Hello and welcome to LOWcast, and it is a very important LOWcast because we have an opportunity to talk to Marina Mamenko, who is a paediatrician in the Ukraine. I'm Andrew Lansley. I'm Strategic Counsel to Low Associates, and for these purposes, of course, also back 10 years ago, I was Secretary of State for Health in England and had an opportunity then to understand the way in which health systems work. And it's in that context I really wanted first, if I may say, Marina, to say from all of us right across Europe, we've been appalled, horrified by the unwarranted aggression that has taken place against the Ukraine. And there is an immense sympathy and support for you and your Ukrainian compatriots in what you're having to put up with. But could I, in our LOWcast, what I want to do is to take the opportunity to hear from you about where you are, how you and your fellow paediatricians and clinical staff in the Ukraine are coping and the difficulties you're facing, and then move to how we across Europe can help the European Academy of Paediatrics, with whom we work. You are a member of that, and you will know that they have launched fundraising to support their fellow paediatricians in Ukraine. So I'd like to hear more about how we can help. But first, Marina, would you be able perhaps to tell us a bit more about the circumstances of the service, the care you're trying to give to children in the Ukraine at the moment? What facilities you have and how you've been able to deal with the obvious trauma and difficulties that children have been facing.
I'll try. It's really very difficult to make a clear picture of our situation for those people who are not inside of Ukraine. And it's really horrible for us too. A little bit more than 1 month ago, we couldn't even imagine such a situation in our country, but now it's a reality. I'm very thankful for you, Andrew, for all who tries to understand the situation well and to help us. The reality is that as the war intensifies and spreads into multiple regions, the children's casualties are mounting. The precise number of child deaths are murky. A total of 144 children have been killed and 220 have been injured during full-scale hostilities as for today. It's only official data, and our officials claim that these data are not final. Since there is no opportunity now to inspect the places of shellings in the areas of active hostilities and in the temporarily occupied territories. Who knows what happened to poor children in Mariupol? Cold, starvation, explosions. There is no way to verify that. I expect, we all expect that the total rate of injuries and deaths will be significantly higher. We know now that something about 300 people may have died from last week's bombing of drama theater in Mariupol. I think everyone in Europe knows about this accident. At the time of attack, the word children was written in Russian in large white letters on the ground in front and behind theater, but it didn't work. That's a catastrophe. Today we heard from the mayor of Mariupol that at least 210 children died in this accident, but it's also not final number, not final data. There is a constant nightmare in blocked cities under the Russian siege. A lot of people there, including children, buried in the mass graves. In their own yards, it's really will take time to count the total number. There is a wide range of physical injuries and certainly psychological, emotional trauma. Since the war began, we have been treating kids for shrapnel, bullet wounds, mine blast injuries, a lot of amputations. It's also reality, brain and spinal cord injuries. Children in Mariupol have been living without access to water. And appropriate and timely medical care was impossible for them for weeks. So reasons of their deaths could be very, very different.
Marina, this does mean many of the doctors and nurses and other clinical staff are encountering a large number of trauma cases. They won't have had much experience of trauma, certainly on this scale or this character of trauma in past years. Is there any way in which you and your fellow doctors can hear from others who have some experience of trauma work and perhaps learn a bit about how some of these trauma cases can be looked after?
I think it's very important for adult doctors, first of all, because they treat our soldiers. And even if we are speaking about a great number of injuries in children, we understand that the total rate of injuries in adults is much more high. We have different channels to connect with our colleagues. We have one hospital at the western part in Lviv, which originally from the United States and NATO, to teach our doctors to help in such situation. But originally in Ukraine, we had the institution of military doctors, of how to find correct word, how to say it. We have even special university in Kiev who is preparing doctors, teaching doctors to make such things during the war conflict. So we have 8 years of experience in Donbass with such situation, a lot of mobile hospitals in this region. And now we have direct connection with our colleagues from different countries. I saw a lot of opportunities to have video calls, some probably semi-activities to teach doctors, and a lot of requests from our colleagues to come and help. Ministry of Health manages these requests, and I think we have help from our colleagues from different countries in this situation.
Marina, this is one of the central tasks of the Red Cross is in conflict zones of this kind to enable medical facilities, supplies, and indeed medical staffing to get to these zones of conflict and to be able to provide services. Are you getting Red Cross services through into Ukraine?
The biggest disappointment so far is a lot of international organizations such as International Red Cross refuse to organize humanitarian green corridors or to deliver humanitarian aid to the occupied and blocked cities. Really, we are very disappointed with the help of International Red Cross. At the beginning of our war, a lot of my colleagues from European Academy of Paediatrics from different societies called me and asked how can they help. And at that time, I said that I don't know how can I manage the situation. The situation is very difficult, and they can ask Red Cross to help and to give money to them. But nowadays, a lot of doctors, and not only doctors, our officials too, said that they don't work effective at all. Sometimes we ask them to deliver some drugs, for example, for children with rare diseases, for example, to Melitopol or Mykolaiv. We have not active war in these cities, but they refuse. They say we will not go to the dangerous places. And they totally refused to make green corridors to Mariupol, and even didn't allow us to use the symbols of the Red Cross to make it safe for our
That's very disappointing.
Yes.
Yeah, that is very disappointing news, because I think it is really important all of us are aware of for 180 years, the Red Cross has been about taking medical facilities, supplies and facilities into conflict zones, into wars, and being able to operate under the Red Cross or the Red Crescent in ways that are recognized by all sides in a conflict. And they should be able to get into the conflict zone and be able to provide relief for you. So that is an important issue for us to take forward with our colleagues in governments here across Europe, and I'll try and do my bit to try and encourage the British government to do its bit in that respect, and I know other colleagues listening to this will do so as well. Clearly, you've been able to evacuate quite a number of children, and hopefully they are now being able to be looked after right across Europe. And I know the European Commission and the European Union are putting a lot of facilities together by way of hospital beds and services for refugee children. Do you think, is there an issue about managing the long-term consequences of this for children, both in terms of their mental health and also making sure that their continuing medical needs are being met and the records are being available to you for the future? How are you and your colleagues feeling about what the prospects are for those children who've been evacuated?
We have different situation with them too, because some of these children went abroad with their families. They were not exactly evacuated. I'm now in the safe place, more or less safe place in the western part of Ukraine, but a lot of families from this region also took their children and went to Europe. They were afraid of the war, and in the first day of the war they had explosions even in this region. So I cannot say that they were evacuated. They just went to Europe, to the most safe countries. But really a lot of children from Kharkiv, from Chernihiv, from some suburbs of Kiev, they were evacuated. And it's a different situation because the first part of children, which went with their families from safe places, they are more or less, they were not so stressed as the children who heard bombing, who was for a lot of days in shellings, who even lost their families. It's a different situation. I think that our colleagues in Europe will have a lot of problems because it's great amount, really. Because it's a pity, but our electronic health system is just under construction. We have only several years of using of this system, and it was available only for doctors in in governmental clinics. So we cannot simply connect the information system in Europe with our information e-health system. So a lot of children will be in different countries without the history of their lives and probably illnesses, without data on vaccination. It will be real problems for our colleagues. We are discussing all the time in the European Academy of Paediatrics. So we have common charter with national societies of different countries. We are discussing all the time the ways how to help and how to manage this situation. I have to say that Poland is really the country which took the great amount of responsibilities in this situation. They take our children and then disseminate them all over Europe, speaking about ill children. Especially in the first days of the war, it was just a great amount of such situation when severe illnesses in children or probably some situation will injure us and we need help, and we disseminate to these children. But now we have such a phase of war, such a stage of war as a chronic disease, when I think that the only one way to stop it, and as something about 90% of families are going to come back as the war will stop. It will be the best decision for the whole Europe too, as I understand that if our families and children will stay in Europe for a long time, all countries have to manage not only to feed them or to make them to be in the safe place, but to think how to give them education or health care. It's a really great problem. We are trying to communicate the whole time. Sometimes I even think that some of our doctors are now refugees too. I mean that doctors who have families, especially if doctor is a woman, she took her child and went to the safe place too. And probably it is an idea to discuss some kind of partial license. I mean to let our doctors to treat our children abroad.
Right.
It seems that it will be help for all European countries, because it's difficult to manage families who have some language barriers, and a lot of our families don't speak English or other European languages. It will give the opportunity for our doctors to work, and it's really help for them, and probably not for all European citizens, but just for Ukrainian children, for Ukrainian families, to give them help.
Yes, I can see that would be an immense help, and that's a very good point that I know some of the other European countries will want to think about how they can make sure that some of your colleagues who are themselves refugees can provide services to the Ukrainians who are refugees in those countries. I'm glad to hear what you said about Poland, because I think we've all admired very much the way in which Poland has opened their homes and their hearts to all the refugees from Ukraine, such a very large number of refugees. But I wonder, time is against us, Marina, but I just wanted in particular to ask you, of course, the European Academy of Paediatrics have been mobilising support and fundraising and wanting to help. And indeed, I wondered if you could say, what is the nature of the help that you and your colleagues are most looking for? Is it funding to buy the supplies that you need? Is it to send supplies? Is it that we should now be thinking about mobilising people with special skills to come and help, particularly if parts of the Ukraine are able to be relatively safe, so that the population can be supported there? What is the help that you really most need?
I've said to you at the beginning that when the war started, I didn't know how to manage with the help to different regions. Now we are a little bit experienced. We are trying to make such platform for communication or for those who need help. I mean, previously clinics and those who can give us such help. It was made on the basis of the website of Ukrainian Academy of Paediatrics Specialties, so we can gather information from different regions, and we found several organizations, charities and volunteers in our country who can deliver to the different parts, even if they are not well controlled by our authorities, our help. Now we can divide the support in different parts. We can take donations. We made a special platform which is connected to Leak Pay and Patron to have some money for our organization to have a possibility to buy something here, as we have some drugs which are just very common, and we can buy here and to deliver them to the eastern parts of our country, which now suffering a lot. Sometimes we have the need in very special drugs. So, for example, for rare diseases, insulins, hydrocortisone for children with endocrinological disease. Then we ask different societies to help us and different companies. And we address to European Academy of Paediatric Specialties, to European Academy of Society of Endocrinologists, different organizations. And then we decide the question about how to arrange and how to manage with the situation, just to bring what we need to the regions. We have different way. We can communicate now and do it in different way with our colleagues abroad, and I'm sure that this help will be essential even if we will stop with the war, because we have a lot of totally or partly destroyed hospitals, and we will need to rebuild them in future. So I hope we will use this platform effectively.
Marina, thank you very much indeed. And thank you for finding the time and the opportunity to talk to us. I know there will be many across Europe who will want to hear what you have to say. And I know, well, you know, just how much your colleagues in the European Academy of Paediatrics and your specialist colleagues want to help, how they are helping, and hearing directly from you will, I think, give them that additional spur to provide all the help that we possibly can, which may be immediate help, but also maybe, as you know, for months ahead, and indeed through the rehabilitation and the rebuilding, which will be necessary after this is, after the aggression hopefully has been repelled.
We appreciate it so much, Andrew, and the help and care of all our colleagues from European Academy of Paediatrics. You personally, thank you so much.
Thank you, Marina. Thank you very much for your time, and we very much appreciate you talking to us today. Thank you very much indeed. Bye-bye now.
Bye-bye.